Hey everybody, and welcome back to my channel. And today I'm going to be talking about the Medway Hospital Different Not Less campaign, and Ginny, the nurse who actually runs this campaign, who I'm going to be talking about quite a lot in this video, has actually sent me some little goodies about the campaign so I can self-promote it and show you more what the campaign is. I'm going to talk through what the campaign actually is, and I'm going to read some of the actual policy that is in this booklet here that I'm delighted to be part of. And I'm just going to read some of the actual policy here that I've underlined. It says, the campaign aims to give information about autism and LD with some of the do's and don'ts and myth busting. An important area is the myth that autistic people or those with LD do not feel pain in the same way. The campaign will also give information on the language to use and signpost you to useful sites to help. 60% of those with autism do not have an LD, but there may still be difficulties in accessing healthcare, especially when unwell. Even summing up the courage to make an appointment or talking on the telephone can be difficult. In our post-COVID-19 era, we are looking to undertake much more of our work virtually rather than face-to-face, so this should be borne in mind. Most importantly, they have obtained feedback from autistic people and those with a learning disability to ask them what they wanted us as health professionals to know. The campaign is designed to work in parallel with the new mandatory training, and we hope, act as a visible way of reassuring your patients and their families when they see you wearing the badge. Which the badge I can actually show you is actually in my little... Oops, sorry for the noise. I know it's probably going to sensory trigger people, but this is the little Different Not Less badge that I've actually got one because I'm part of the campaign for supporting it. So I just thought I'd show you that. And then it says the initial plans were to launch this campaign were delayed by the COVID-19 pandemic. Sadly, however, during this pandemic, the CQC reported a 175% increase in deaths of people with an LD living in adult social care, with much concern in the application of NHS COVID-19 decision support tool, which made no allowances for LD, and the application of the do not resuscitate DNAR decisions. Therefore, we need to improve understanding and reassure our patients and their families to be more imperative. Ginny. So, Ginny has two autistic boys. I won't show the picture just in case she doesn't want me to, but the lady, she's basically the lady there. I'm trying not to show the picture, but that's her there. And I'm going to talk a little bit more about what this campaign actually is and what it actually is. So, what are the key principles of the Not Less Initiative campaign? Not Less Initiative pledges to promote equality in care and to not make assumptions about our patients with autism or learning disabilities, and to listen to them and their family. We will ask you to wear our badge to show your patients and their families that you want to care, to listen, and to understand. We want you to feel empowered by the campaign to challenge other healthcare professionals if you do not think they are treating patients with autism or learning disabilities equally, listening to them or their families, or trying to understand. So let me give you a little bit more background information and the do's and don'ts. Background information. There are currently 1.4 million people with a learning disability in the UK. These may be mild, moderate, severe or profound. 700,000 people in the UK with autism, which is more than 1 in every 100. 40,000 people in the UK with Down syndrome. That's 1 in every 1,000 babies. 40% of autistic people have an LD compared to 1% of people without an LD. 60% of those with autism do not have an LD. 20 to 40% of adults with autism have considered killing themselves, with 15% report making at least one attempt or more. The risk of a child with autism making a suicide attempt is 6 times that of other children. Women with a learning disability die 20 years sooner than the general population, and men 13 years sooner. The LEDER, which is the Learning Disability Mortality Review 2019, has shown a median age of death for males with a learning disability of 60 compared to 83, and for women of 59 compared to 86 within the general population. Severity of learning disability, median age of death. People with a profound or multiple learning disability, 40 years. People with a severe learning disability, 57. People with a moderate learning disability, 63. People with a mild learning disability, 62. So what are the do's and don'ts? Don't assume a person with autism or learning disability does not have the capacity. Remember, 60% of people with autism do not have a learning disability. Do not assume that we don't feel pain or that we experience pain difficulty. Don't assume that we won't understand. Don't assume we won't tolerate treatment. Do not assume that we don't have a good quality of life. Is having tantrums rather than meltdowns due to the sensory processing? Please do not assume that, because you are so far wrong. But do these things. Ask your trust learning disability liaison nurse for help. Ask how to help it make it easier. Ask if we want it written down or diagrams drawn. Ask our family or carers, and ask if they have a health passport. So this is just some things you can do to make it easy. So what's the myth busting about pain for people with learning disabilities and autism? Pain, it is a myth that people with autism or learning disabilities do not feel pain. A confidential inquiry into the premature deaths of people with learning disabilities report 2013 found out that more than half, 56% of those with learning disabilities, were reported as being able to identify and verbally communicate their pain. More than a third, 38% of people with a learning disability, had difficulty in identifying or verbally communicating any pain they had. For almost all of these people, their family or carers were able to describe what indications the person would give that they were in pain. Typically, they would be described as being tolerant. So most people experience a significant degree of pain. Significantly, 32% of those who could describe their pain were on opioid and analgesics at the time of death, compared with just 12 of those who couldn't. This may indicate that people with more severe learning disabilities were having pain at the end of their lives, being suboptimally managed. There are tools available for assessment of pain if the patient is unable to communicate their pain, such as the Disability Distress Assessment tool. And it also says our physical sensory maps are different, so recognising that in reporting your pain and discomfort will also be less likely to be expressive. And it says that a relevant case here, that someone broke their clavicle as a child. It was about 4 days before they went to A&E because they didn't have no pain. So again, communication. Make sure that you get the language right. Many autistic people are proud to be autistic. It's part of who they are. They prefer the term autistic, e.g. he is autistic, or an autistic adult, never the noun an autistic. Parents may prefer the on the spectrum. Avoid the terms Asperger's or Aspie. They are no longer given as the diagnoses. That's true, but still the word Aspie is used. So, yeah. Use of the word condition is okay and in the right context. Disability, but disease or disorder should be avoided. Absolutely agree. Don't use mild or severe or high and low function autism. Oh my god, that drives me bonkers. Absolutely agree with this. Instead, say autistic with or without learning difficulties. Do not use non-verbal to describe autistic people who speak few or no words. Minimally verbal is more acceptable and should be avoided if possible. Don't use negative language like suffering from or paralysed by. Use this language when talking about co-occurring difficulties, e.g. the person suffers with anxiety. Avoid abstract language, sarcasm or metaphors. Some autistic people will take things too literally. So yeah, I hope you've enjoyed this video. I've attached a more in-depth film about the Different Not Less campaign. And please give this a like, comment, share and subscribe, and I'll see you next time. Bye!
We're really proud to be launching the Different Not Less campaign, which is a campaign to promote understanding of autism or learning disabilities. This campaign has come about after, about a year ago, I was watching the Panorama programme, which looked at the abuse of vulnerable young adults at Walton Hall. This was a particularly personal programme for me to watch because I have twins who are 13 and autistic with severe learning difficulties. By the end of the programme, I was in tears, knowing that at some point I will need to entrust the care of my twins to other people and not wanting them to be subjected to this form of abuse. The premise of the campaign is to promote that we will care, listen and understand. We know from previous reports, such as the Leader report, that the life expectancy of people with learning disabilities is much shorter than the average adult in the UK. It's around 25 years. So knowing that my twins will live for 25 years less than my eldest son simply because they have autism and a severe learning disability is extremely hard. We ask that you will wear our badge as a visible symbol for our patients, their families and carers that you care, listen and understand. We hope you will agree that this is an extremely important campaign to improve the care of our vulnerable patients who don't always have a voice and who don't always feel understood. Thank you.